If you own or manage a healthcare practice, you've probably heard people say you need to make sure you're compliant. But what does that actually mean? And what does a healthcare compliance consultant actually do? Hi, everyone. I'm Dr. Natasha Guess, and I've worked in healthcare for more than 11 years. And throughout my career, I've seen the same challenge over and over again. Healthcare practices are expected to comply with a long list of requirements, but knowing what those rules say and actually making those requirements work inside a BC practice are two very different things. That's one of the reasons I became a healthcare compliance consultant. I'm on a mission to make compliance simpler by helping small and mid-sized healthcare practices build compliance into the way they actually operate. So what does that look like? A healthcare compliance consultant helps you look at what is happening inside your practice and identify where there may be gaps between what should be happening and what is actually happening. For example, you may have HIPAA policies, but have your employees been trained on them? Can you show when that training occurred? And you may have vendors that signed a business associate agreement, but who is responsible for making sure those agreements are collected, reviewed, and maintained? You may even have a process for terminating your employees. But when someone leaves, who makes sure that their access to your systems is actually removed? And now we have another layer in healthcare: artificial intelligence. Your employees may already be using AI tools to draft emails, to summarize information, to create patient education materials, or to help with administrative tasks. Who has the authority to approve those tools? What information can employees put into them? And what happens when someone wants to use a new one? Those are compliance questions, but they're also operational questions. And that's where much of my work happens. When I work with a healthcare practice, I'm not simply looking for policies in a binder. I want to understand how the practice actually operates, who does what happens when something changes, where is the documentation, and who is accountable. And can the practice demonstrate that its compliance processes are actually happening? From there, I may help a practice assess its compliance operation, identify gaps and risks, develop or improve policies and procedures, or strengthen HIPAA and privacy processes. I may help improve workforce accountability, evaluate your vendor oversight, help to prepare you for an audit, or build monitoring processes. But ultimately, my job isn't just to hand a practice more documents. It's to help leadership create practical compliance systems that people can actually follow. This becomes especially important when a practice is growing. Maybe you started with 3 employees and now you have 15. Maybe you're adding another location. Maybe you're hiring new providers. Maybe you've just introduced telehealth. Maybe you're using more vendors or adopting new technology. The practice has changed, but has your compliance operations changed with it? That's the question I want healthcare leaders to start with. And you must start asking these questions because compliance shouldn't be something you only think about when there is a complaint or an audit, a breach, or a letter from a regulator. It should be part of how your practice operates every single day. So if you've ever wondered what a healthcare compliance consultant actually does, that's the simplest way I can explain my work. I help healthcare practices find the gaps between their compliance requirements and their day-to-day operations and build practical systems to close those gaps. If you're a healthcare practice owner, administrator, or leader, subscribe to the channel. I'll be breaking down healthcare compliance in practical terms and talking about the issues that can affect your practice as it grows. And remember, keep it simple, stay compliant, and protect your patients.